thank you for joining us today. I'm joined by our Deputy Mayor, Harkirat Singh, and by Rowena Santos, who is the Chair of Community Services and Regional Council for Wards 1 and 5, but also serves on the Federation of Canadian Municipalities Executive. We want to speak today about an issue that is impacting our community and communities across the province and country. We are calling on the province of Ontario to implement a compassionate and necessary solution for individuals suffering from severe addictions, concurrent mental health disorders, and brain injuries. As we like to refer to this as compassionate intervention. On September 15th, British Columbia made a significant announcement expanding involuntary care for individuals facing concurrent addiction, mental illness, and acquired brain injuries. They also unveiled plans for high security facilities under the BC Mental Health Act. BC has sort of been on the forefront of challenges with addictions, and they've had some very tough conversations about how we can help. This conversation that they've had in British Columbia is long overdue in other parts of the country. The approach from British Columbia offers a vital lifeline for those in crisis, helping individuals regain control when addiction obstructs their ability to seek help. It's why we have reached out to the province to request a pilot project occur here in Brampton and in Peel region. The current voluntary treatment framework, while effective, leaves a significant gap for those unable to seek help due to the severity of their condition. And I want to share with you today the data that we have seen that I believe really highlights why this is merited. We know that between January of 2022 and June 2024, there was a total of 1,851 police-attended overdoses in Peel region. And sadly, there was 328 fatal overdoses. Many of these fatalities had prior overdose occurrences, and so I cannot stress enough the importance of early intervention and intensive treatment. By prioritizing timely interventions, we can reduce harm, promote recovery, and foster a healthier, more resilient community where everyone has the opportunity to rebuild their lives with dignity. The same old approach isn't working. I don't want to hear about hundreds of more overdose fatalities. The collaborative strategy is essential to ensuring every individual has access to care and support they need, ultimately enhancing community safety and well-being. The recent policy shift on the West Coast reflects a crucial step in tackling the growing challenges of mental health and addictions, which intersect with homelessness, housing insecurity, and encampments. I know Councillor Santos has been outspoken about the challenges we face with encampments here in Peel region. In Brampton, like many cities, we are witnessing the profound effects of mental health and addiction issues exacerbated by the housing affordability crisis. Mental health and addiction, homelessness are not just social issues, they are pressing public safety concerns. Our emergency services, hospitals, and shelters are experiencing, and this is not an overstatement, unprecedented demand as these challenges grow more complex. Peel region is facing a drug toxicity crisis with 705 lives lost in the last 5 years. In 2023, Peel region experienced 573 opioid-related emergency department visits and sadly 147 opioid-related deaths and 34 deaths so far just in 2024. Fentanyl was a key contributor in 9 of the 10 of these deaths in 2022 and 2023. Since 2010, visits to Brampton's Mental Health and Addictions Emergency Department and Urgent Care have surged by a staggering 121% compared to the provincial average of 54%. We're feeling this in Brampton. Since 2022, Peel Regional Police have received 33,891 calls specific to mental health and addiction crises. This is only a small portion of the calls for services associated with these issues, but 33,000 since 2022 to the Peel Police. Since that time, there were approximately 12,000 apprehensions by the Peel Regional Police of 8,000 individuals at a rate of almost 14 mental health apprehensions per day in Peel region. We have one instance locally where the individual had 53 apprehensions. This is not police doing police work. This is police having to fill the void because government hasn't acted. As first responders, Peel Police spent 30,000 hours waiting in a hospital since 2022, rather than on the front lines protecting the community. Among the 8,200 who were subject to mental health calls, nearly 3,000 were subject to additional calls to police, illustrating that mental health and addictions are root cause in a wider range of police occurrences. This is 11,340 frontline officer shifts, and obviously a huge impact on our police budget. I'll now pass it over to Councillor Santos, Chair of the Community Services Committee, to speak about this as well.
Thank you so much, Mayor Brown. As Brampton's population continues to grow, so does the demand for essential services as well as affordable housing. Unfortunately, more residents are facing significant challenges in securing a home, leading to a rise in homelessness and encampments across the city. And our city in Brampton, the area I represent, certainly we've been feeling the impact of encampments. These encampments, often hidden from public view, reflect not only a lack of shelter, but also inadequate access to mental health and addiction services. The opioid crisis and rising substance abuse issues in Peel Region, particularly here in Brampton, have deeply impacted the homeless population. Many individuals are struggling with both addiction and mental health disorders, which are often interconnected and further exacerbate their vulnerability. These issues pose significant risks to the health and safety of all residents, including those living in encampments. The growing number of overdoses and substance-related deaths highlights the urgency of addressing this crisis through a compassionate and holistic approach. It's something we've been asking all orders of government many times, especially when dealing with the homeless population. While voluntary treatment is always preferable, there are instances where compassionate intervention may be necessary to protect the well-being of individuals and the broader community. This treatment should be seen as a last resort, used only when an individual poses a serious threat to themselves or others and when less intrusive measures have been completely exhausted. Respect for human dignity is paramount. Compassionate intervention should focus on rehabilitation and reintegration rather than punishment or control. It is critical any policy be paired with broader initiatives addressing the root causes of addiction and homelessness. Simply detaining individuals for treatment without tackling the underlying social determinants such as homelessness will not result in lasting recovery. Additionally, safeguarding individuals' rights is essential, ensuring legal recourse, regular reviews of treatment orders, and the provision of advocates to represent those undergoing treatment. Given Brampton's diversity, solutions must be tailored to meet the unique needs of varied communities. Language barriers, cultural differences, and diverse experiences with mental health and addiction require innovative and inclusive approaches. Many of the communities in Brampton still have a stigma when talking about mental health and addictions. New legislation must prioritize long-term rehabilitation and culturally appropriate treatment options, especially for Indigenous and marginalized populations disproportionately affected by addiction. Compassionate intervention cannot exist in isolation. It requires collaboration between healthcare providers, social services, law enforcement, and community organizations, and requires adequate funding for mental health addiction services, and affordable housing is also essential to prevent this treatment from becoming a temporary fix versus a sustainable solution. Through collaboration with provincial and regional partners, including Premier Doug Ford and members of provincial parliament, policies can be developed that benefit Brampton, Peel Region, and Ontario as a whole. By focusing on comprehensive, compassionate care, Brampton can work towards building a community where no one is left behind and every individual has access to the support that they need. This is about prioritizing the health and safety of the individual and the public at large. Thank you, Mr. Mayor.
Just to underline what Councillor Santos said, the compassionate intervention that we're calling for to have this pilot project here cannot exist in isolation. If you look at the announcement on the West Coast in this new policy that has been presented by the government of British Columbia, it is coinciding with significant investments in treatment at the same time. And there are opportunities for that locally, and we're having active conversations with our Minister of Mental Health, Michael Tobolo, who I know is a champion of increased treatment. On that note, you know, I've always been a big believer of thinking outside the box, and when you're presented with a challenge, that if there is a will, there's a way to help. And I believe right now we've been presented with a model in British Columbia that can help. It's just tragic when there's preventable overdoses. It's tragic when we continue to hear about fatalities in numbers that are so staggering. But we've almost become immune. We're so used to it that we're ignoring the gravity of the situation, and that's what we don't want to continue. So on that note, we'd be happy to take any questions on why Brampton is pushing for this pilot project.
Okay, I'll start on this side of the room. Just as a reminder, one question, one follow-up. State your name and outlet.
Hi there, Alan Hale from Queen's Park today. Okay, so Premier Doug Ford was asked about compulsory treatment yesterday, and he said that Michael Tobolo is a big fan of this idea. Didn't really go much more into that. Can you tell us a little bit more about what discussions you've had with the PC government about this? Is Michael Tobolo in favor of this pilot project? Where do you see this compulsory treatment being something that is rolled out across the province?
So, I know in British Columbia they refer to it as involuntary treatment or compulsory treatment. The term that I prefer is compassionate intervention, and I have spoken to the minister about it. I know that he is, you'd have to speak to him directly, but I know he admires the work, the groundbreaking work being done in British Columbia to address this, and I hope that the government, right now, knowing that there's no monopoly on a good idea, and a good idea that works to combat addictions in British Columbia can work here, you know, I think there's going to be a real openness to look at regions in the province that would want to pilot this. So on that note, I'd say anything follow-up would go to the provincial government, but we're ready to be one of those initial pilot projects.
So the Ontario Big City Mayors Caucus has got a resolution in front of it that's coming up, I guess, on the 18th, that also calls for compulsory mental health treatment, and even suggests that the province should use the notwithstanding clause to implement it, to defend it against charter challenge. I was wondering if you could you explain the origin of that resolution? Is that something you were working on, and can you talk a bit about why we would need the notwithstanding clause?
So this is an active conversation amongst a large number of big city mayors, and they are having a meeting on this on October 18th. And I would say there are other mayors who are just, they can't believe what's happening in their communities, and that there's a strong feeling that the same old approach of accepting the status quo and accepting hundreds of overdose fatalities is unacceptable. It's inhumane. And so I know the mayor of Windsor has been outspoken about this. The mayor of Barrie, Alex Nuttall, is outspoken about this. The mayor of Brantford, and the mayor of Kingston, where they had a recent heartbreaking tragedy. And so I will certainly be supporting the resolution. It's not my resolution on October 18th, but I will be supporting the resolution put forward, which I believe is by the mayors of Brantford and Barrie and Kingston.
Hi there, it's Chris Glover with CBC News. The Canadian Civil Liberties Association has already responded to this kind of intervention, saying that it quite likely is unconstitutional and would infringe upon the rights of a person to have them get treatment that they did not ask for themselves. So what do you say to the concerns that this kind of goes above and beyond and kind of detaining people and forcing them into treatment, even if under the advice of a doctor, is something that infringes on people's rights?
Well, certainly what has been presented in BC could be tested in the courts. I think there is an indication that it will. but we simply can't accept hundreds and hundreds of preventable fatalities. And we've obviously been doing extensive consultation on this with those that are working in this space. And one response I was given is if someone's in the midst of a heart attack and is not able to explain they need to go to the hospital, you're still taking them to the hospital for treatment. And there are individuals who are on the verge of fatality that desperately need treatment. And as a society, are we going to allow more and more of these preventable fatalities?
Now, I was at the Premier's press conference yesterday. I don't remember the quote that you were talking about, but I did ask the Health Ministry for a statement today, and their reaction was our government's focus is on creating a system of care that prioritizes connecting people who want treatment. So it certainly sounds like in that statement that they sent us this morning, they're not interested in this. So if the province doesn't play ball here, is there any other way that you can go about doing this?
So that's the current policy of the provincial government, but we're hoping to nudge the government away from the status quo. I know there are champions of this in the provincial government, and the Premier has always worked in a collaborative fashion with big city mayors, given the fact there was a growing number of big city mayors saying we can't allow hundreds of preventable fatalities in our community. We can't grow numb to the reality of almost daily overdose deaths. And so I'm optimistic that there's going to be support for I'm cautiously optimistic there's going to be support for a pilot project here, and possibly other parts of the province. I know there's other mayors that are very interested in this as well.
Good morning, Mayor. This is Nitin Chopra from Prime Asia. Thanks for addressing this issue of overdose deaths, and every region needs it. Since you want to see the legislative changes at the province level, but we have seen that indigenous people, they are being not given the disability benefit because the trauma they are seeing for generation and generations. Seniors, they are facing the mental health issues. These overdose deaths, not only in Peel, but across the country, across the regions. So legislative changes in the provincial level, but what you need to see through federally, because you are the one who was the biggest advocates for the bail reforms, and in this also, what changes you want to see at federal level also, so that overdose deaths can be tackled across the country, and this mental crisis, even seniors can be helped with that. Thank you.
So in terms of this policy, although the legislative authority for it would be on a provincial level, obviously having all levels of government work towards this would be helpful, and having the Government of Canada continue to invest in a more significant fashion into treatment would help. Obviously what we see in British Columbia, this is coinciding with treatment at the same time, is absolutely necessary, and so to have the federal government supportive is obviously would be very helpful.
We've asked the NDP leader about this, and she called this kind of idea like institutionalization. And I think a lot of people are going to have that worry that this is a return of people being dragged off to mental hospitals unwillingly and kept there for indeterminate amounts of time. And we've saw in the decades past that such situations were rife with abuse, and there was a reason that they were ended. Can you like put forward your argument of why this is not going to be institutionalization?
And certainly I wouldn't support institutionalization. This is in British Columbia, where the NDP government there has been the first in Canada to embrace this. I think the reason the New Democrats in British Columbia did is they set key criteria. There was 4 criteria that must be met. There was checks and accountability on the treatment, and our current approach is not working, and that's what it comes down to. And I really don't believe this is a partisan issue. In British Columbia, you've seen all partisan affiliations come together, from Conservative to NDP, to say we can't accept a system that allows daily fatalities that we know in our heart of hearts could have been prevented with treatment. And so, yeah, I believe there needs to be rigorous checks on this. Respectful of civil liberties, but at the same time, if we can save lives, then we have to step up.
Sorry, I had another question and it's completely slipped my mind.
So maybe
That's
let's
okay.
go right here and then follow.
Good morning, this side is Tarun from Red FM. Last year, Peel approved safe consumption site at regional headquarters despite the concerns of local councillors. So that is 10 Peel, Peel Drive Center. So on one side, we are talking about the drug overdose deaths, and other side, we are trying to provide the places for that drug usage. What's your stance on this?
So I think that's a separate conversation. Obviously, the provincial government has put safeguards on where those sites can exist, and I know that is a separate controversial debate. The province has been very clear that these sites cannot be near daycares. Today is about compassionate intervention. I have my separate concerns about the success of these facilities, but I'll save those concerns for another day. And of course, I articulated them at the regional council when that location was discussed.
Thank you.
Hi Mayor, this is Monarch from Y Media for Channel Y. Good morning. So my question to you is, can you emphasize a little bit more on how does city plan to engage communities, particularly in addressing these issues? And how is the city gonna make sure that this issue, it's a big issue, so how the upcoming generation doesn't fall into trap of such things? So how is city planning to engage with the communities?
So obviously there are those in our community who are on the front lines. And too often in Canada, when we've seen these overdose crises, there's a tendency to look the other way. And you have small groups that are working to help. But it's not being given the attention that it merits. It's one of the reasons what we have this very public call today is to say we want to spark this conversation, that we don't want to accept daily overdose fatalities in our community. And so I know in terms of consulting the community, we have, for those in our community, whether it's been physicians that I've been speaking to at the hospital, whether it is those who provide food insecurity and homeless services who have seen within their own vicinity overdose fatalities that Councillor Santos has been speaking to on a regular basis, whether it's community activists that our deputy mayor has been engaged with. We are listening relentlessly, and it's because of that listening that we have spoken up to say that we want to be one of those first pilot areas, that we don't accept the broken status quo when it comes to addictions.
Thank you.
I will follow up, Mayor. In British Columbia, we had seen that decriminalization of hard drugs like fentanyl, that also happened there. So you are not in favor of that because that is not the solution, what we think, to stop the overdose, or you are not in favor of that?
No, I do not support decriminalization of additional prohibited substances in this country. And obviously in British Columbia, they revisited what was viewed as a failed policy. But once again, that's a completely separate conversation. Today is about compassionate intervention. Thank you for joining us today. And if there are any follow-up questions, our media team can respond to those.